These hemorrhages are perhaps one of the most important risk factors for glaucoma onset and progression, along with intraocular pressure. So I'm going to focus on these hemorrhages. What does it mean? What should we do? And how does it relate with pressure? These are my disclosures, none of them related with this talk. So as a background, Jerome was the first to describe these hemorrhages in 1889, but was Jones in 1969 who provided the first systematic description of these hemorrhages and its association with visual field progression. We know that they can occur in basically every individual, less so in healthy subjects, but they tend to be more common in those with low pressure glaucoma for reasons we don't know yet. All the major randomized clinical trials that tested this hemorrhage found a significant association. This is the CNTGGS, showed a 2.7-fold increase in the risk of progression. The EMGT confirmed with a smaller effect size, but still significant. And the ocular hypertension showed in the multivariable analysis almost 4-fold increase in the risk of glaucoma onset. But most important is that not performing disc photographs was a significant associated with not detecting hemorrhages. So it's important to document with disc photos. So do all patients with disc hemorrhage progress rapidly? So that's the question. Does it mean that you have a disc hemorrhage, you're going to progress? In this study, we showed that no. So it's actually those patients who are older and with worse baseline mean deviation. They're the ones that are most likely to progress faster. And what causes disc hemorrhages? There are many theories. Our group is amongst the groups that propose a mechanical theory. You have pre-existing damage, such as here, and this hemorrhage is a byproduct of fast progression at that location. And this was recently discussed in progress in retinal and eye research, showing some remodeling of the tissue when you have very fast progression at a local area around the disc. In fact, we showed this in 2009 when we looked at progression in disc hemorrhage eyes, and we showed that they were progressing fast even before the hemorrhages were detected. And most interesting, the location of progression was consistent before and after. This is an example of a patient that was presenting significant progression before the disc hemorrhage was actually detected. Was it because there was a previous hemorrhage that we did not see? We don't know. Another important factor is the rates of this hemorrhage that was compared also looking at OCT by the San Diego group, and they also showed that the patients are progressing fast even before they have a disc hemorrhage detected, especially locally in the quadrant. And do recurrent disc hemorrhages increase the risk of progression? There's a lot of debate. The best data comes from the OATS. And if you look, they see that, one, not every patient with disc hemorrhage progresses, but the more disc hemorrhages you have, the more likely you are to develop glaucoma. And does treatment decrease the incidence of disc hemorrhage? So one question is whether treatment decreases the rate of progression. The other is whether treatment decreases the incidence of disc hemorrhage. So this was done in the OATS recently. They found a significant effect, so the treatment arm was less likely to develop disc hemorrhage. This was not shown in the earlier publication. The MGT, however, did not find any effect, so both treatment and observation had a similar incidence of disc hemorrhages. What do we do to slow the incidence of disc hemorrhage? So we know that trabeculectomy is very effective. In this study from Japan, reducing the pressure significantly with trabeculectomy significantly reduced the rate of disc hemorrhage incidence. Now, what's most important? What's the effect of intraocular pressure lowering once your patient develops a disc hemorrhage? Are they going to progress more slowly? So this was investigated by the San Diego group, and they showed, at least as far as visual fields, that yes, there's a significant relationship between the amount of IOP lowering and the slowing of the rate of progression after disc hemorrhage. In fact, for each millimeter of mercury, it decreased by 0.3% in the VFI. But you need to have a reduction that's very substantial, about 5 millimeters of mercury. And does the IOP lowering slow the rate of RNFL progression after disc hemorrhage? So I just showed visual fields. The same was also shown when looking at OCT. Notice that in the unchanged treatment arm or eyes, there was actually an increase in the speed of rate of progression, but once you significantly lower the pressure, the rate of progression reduced significantly. And again, for each millimeter of mercury, there's lower rate by 0.1 micron per year. So the take-home messages are not all eyes with disc hemorrhage will experience rapid progression. These are mostly the ones with older age and worse visual fields. At the time of this camera detection, the corresponding region has already been progressing rapidly, so you should track that location, look in the future. And IOP reduction reduces the rate of this hemorrhage incidence and glaucoma progression. Thank you.